All right, well, welcome in Wish TV medical reporter Dr. Mary Gillis now joining us here on Midday, as she does Monday through Friday, to kind of answer some questions. Today we're talking about elective surgery, okay? One in particular, you came across one out of Seattle. They're saying right now the recommendation, if it's elective surgery, to put it off right now because they're trying to treat this coronavirus. What quantifies as elective or not?
Well, there really is no rule book for what's considered elective surgery. Hospitals have to make decisions based on their resources and what they have during this time. But what I was really thinking about was this case out of Seattle where a woman who was slated to have a lumpectomy because she had a tumor that needed to be removed. Her surgery was postponed indefinitely. This cancer had spread to her lymph nodes. This hospital classified her surgery as elective. There is no rule book. Like I said, eventually this woman did get her treatment. Okay. She did get her chemotherapy, her lumpectomy. But it just raises the question, would someone? We have to do what we're doing right now in terms of this crisis. Absolutely. Hospitals only have so many resources. But with someone who's suffering from chronic pain, like who needs hip replacement,
right,
would they consider that elective? Well, chronic pain is associated with suicide. So what about a baby who's born with a cleft palate? I mean, is that elective? I don't know. I don't have the answer. I don't have the answer. It just really raises a question as to sort of what's going on these days in terms of medicine.
Right. It seems like right now it's probably a decision. I know Seattle was one of the big initial outbreaks of the coronavirus. So maybe they were just clamping down and saying, hey, we need you over here to work on this right now. But that would seem like that would be serious enough to, do a lumpectomy. Fortunately,
she was able to get her treatment and she's okay. But I mean, there are tough decisions that we need to make these days. And not only these surgeries have to happen for these individuals, and some can be put off, of course, but hospitals are losing revenue because they're not able to do these surgeries.
Yeah. Probably a decision made with the doctor as well. All right, Dr. Mary Gillis, thank you so much for stopping by. We appreciate it. All right, we're going to toss it out to Randy now, who's comfortably at home right now. Hey, Randy.
Yeah, hey there, Mike. Sitting up here in Aliceville, city's northeast side, and boy, beautiful day out there. I'm going to start out by showing you what we had during the day on Monday. It was a great day yesterday, too. Highs did climb up mainly 70s and some upper 60s. Here in the city, we topped out at 70 degrees, 72, Shelbyville, and also Bloomington, also down around the Bedford area. Outside right now, mixed cloud, some sunshine. Temperature really not bad at all. We're at 68 degrees. Got a west-southwest wind, that wind coming in about 10 miles an hour. 68 here, 71 Lafayette, 71 Bloomington, 70 Muncie, and 69 in Shelbyville. So we head through this afternoon. Should be okay. We'll keep it dry, partly sunny, breezy. By noontime, 72 o'clock, 72. And by 4 o'clock, our temperature at 75 degrees. And everybody should climb up into 70s today. 74 Muncie, 75 here. Terre Haute, Bedford, Columbus, your high at 78 degrees. Here in the city, forecast high 75, 15 degrees above average. Our record for the date, that is at 83 degrees. We do have a warm front now pushing in across the area. Earlier, that triggered some thunderstorms across parts of northern Indiana. And then we have the first of two cold fronts coming down. That will bring us, I think, a better chance for some scattered storms overnight tonight. Here's a look at radar. Again, not much going on here. The thunderstorms up north, those are pushed into parts of Ohio between Columbus, Cleveland, back out to around Pittsburgh. And notice, not much going on behind it. Now, as we head through this afternoon here, again, mixed clouds, some sunshine, or it could be a spotty shower, but boy, most areas should be on the dry side. We'll take it out. We'll stop it at 7 o'clock during this evening. And then later tonight, thunderstorm chances will be on the increase. Much of Indiana under a slight risk of severe weather overnight tonight into early tomorrow morning. I think the biggest threat will be some damaging winds, some hail, and maybe some heavy downpours here, too. Let's go back to the map. 7 o'clock this evening, we're looking A-OK. And then around midnight, you can see right there a little batch of a line of some showers and thunderstorms here forming. So around midnight or so, and then shortly thereafter, the thunderstorms will press on down to our south, and we should clear it out for a nice day during the day tomorrow. Lows here tomorrow, 63 here, 50s north, low 60s down to our south. Wednesday, the rain ends early. Should be another great day, partly to mostly sunny skies. One more warm day here, and then tomorrow night, here comes a big cold front. Again, rain returns, maybe a few thunderstorms, and we should turn much cooler later this week. Also tomorrow, especially tomorrow night, a marginal risk of severe weather. Temperatures tomorrow afternoon, upper 60s and lower 70s. And temperatures on Thursday, boy, a lot colder. Highs only in the upper 40s and lower 50s. Your Chapman, heating and cooling and plumbing 8-day forecast. Thursday, maybe some early morning showers. A windy day, high of 48. Good Friday, 47. A rather chilly weekend will keep Saturday dry. And it looks like a really good chance of rain on Easter Sunday, high of 52. The rain may end up some snow showers here come Sunday night into early Monday morning.
All right, Randy, thank you so much. Coming up, how one local couple is continuing to deliver stem cells to cancer patients despite the pandemic.
You're watching Wish TV, Indiana's only statewide TV news network.